Hi, my name is Kate Calo, and I'll be doing chronic congestive heart failure. I chose this topic because about a year and a half ago, my father passed away from congestive heart failure. So understanding a healthy heart flow and the blood flow. A healthy heart pumps oxygen-rich blood to the entire body and circulates used blood back to the heart. The pathway of the blood circulation is the right side of the heart pumps blood to the lungs, while the left side pumps blood to the rest of the body. Low flow from the body enters the right atrium through the vena cava. It then flows into the right ventricle, where it is pumped to the lungs through the pulmonary artery. In the lungs, oxygen is loaded onto red blood cells and returned to the left atrium of the heart via the pulmonary artery. Blood then flows into the left ventricle, where it is pumped to the organs and tissues of the body. Oxygen is downloaded from red blood cells, while carbon dioxide, a waste product of metabolism, is added to be removed in the lungs. Blood then returns to the right atrium to start this cycle again. What is chronic congestive heart failure? There are several types of heart failure: right-sided or ventricular heart failure and congestive heart failure. I will be discussing congestive heart failure. CHF affects the chambers of the heart. Chronic heart failure affects the chambers of the heart. It develops when your ventricles cannot pump enough blood in sufficient volume. During a chronic congestive heart failure, blood flows down and begins to back up in the veins, causing excess fluids to accumulate in the body's tissues. There is often swelling in the legs and ankles. However, it can occur in other parts of the body as well, such as your abdomen, liver, and lower body. When the heart cannot pump enough blood, it tries to make up for this by becoming larger. By becoming enlarged or hypertrophic, the ventricle can contract more strongly and pump more blood. When this happens, the heart chamber becomes larger and the muscle in the heart wall becomes thicker. The heart also compensates by pumping more often to improve blood output and circulation. The kidneys try to compensate for a failing heart by retaining more salt and water to increase the volume of blood. This extra fluid also can cause edema. Eventually, as the condition worsens over time, these measures are not enough to keep the heart pumping enough blood needed by the body. Kidneys often weaken, and under these circumstances, further aggravating the situation and making therapy more difficult. Types of congestive heart failure. Left-sided congestive heart failure damages your left ventricle, the chamber that pumps blood to the body. And this is the most common type of congestive heart failure. It can cause fluid to build up in your lungs, which makes breathing difficult. Then you have right-sided congestive heart failure, which may accompany left-sided, but does not always. Right-sided CHF is when the right ventricle has difficulty pumping blood to the lungs. The blood builds up in your blood vessels, which causes fluid retention in your lower extremities, abdomens, and other vital organs. Here's some demographics on congestive heart failure. Despite significant progress in the prevention and treatment of cardiovascular disease in the United States in the past 2 decades, national statistics indicate that the incidence and prevalence of chronic heart failure have been increasing steadily in recent years, especially in the elderly. It is estimated that about 4 to 5 million individuals living in the United States have chronic heart failure, with 400,000 new cases occurring each year. Chronic heart failure results in almost 1 million hospitalizations each year and is the most common hospital discharge diagnosis in patients above the age of 65 years. The elevation and care of patients with heart failure, not taking into account lost wages and productivity, costs our society in excess of $11 billion each year. Heart failure is responsible for 11 million physician visits each year and more hospitalizations than all forms of cancer combined. It is equally frequent in men and women, and African Americans are 1.5 times more likely to develop heart failure than Caucasians. Deaths from heart failure have decreased on average by 12% per decade for women and men over the past 50 years. CHF affects all ages, from children to adults. There's almost 1.4 million cases under the age of 65. Here's some causes of congestive heart failure. Coronary artery disease, which is a disease of the arteries that supply blood and oxygen to the heart. It causes decreased blood flow to the heart and muscles. If the arteries become blocked or severely narrowed, the heart becomes starved for oxygen and nutrients. Cardiomyopathy is damage to the heart muscle causes other than artery or blood flow problems, such as from infections or alcohol or drug abuse. A heart attack occurs when a coronary artery becomes suddenly blocked, stopping the flow of blood to the heart muscle. A heart attack damages the heart muscle, resulting in a scarred area that does not function properly. Conditions that overwork the heart, including high blood pressure, valve disease, thyroid disease, kidney disease, diabetes, or heart defects present at birth, can all cause heart failure. In addition, heart failure can occur when several diseases of conditions are present at once. Some signs and symptoms. Early signs and symptoms is fatigue. Early heart failure can go undetected, but there are some early symptoms that often resemble a common cold or flu, such as fatigue, chills, and fever. As heart failure advances, more obviously, symptoms develop. Sudden weight gain between 3 to 4 pounds in 1 to 2 days or 2 pounds overnight. Swelling in the legs and ankles, also known as edema. The swelling is caused by a buildup of fluid. Swelling, bloating, or pain in the belly can make you feel much earlier while eating. Trouble sleeping, which may be caused by problems other than heart failure, but it is known to be a symptom of heart failure. Frequent dry hacking cough, which most often occurs when lying down. A loss of appetite or nausea. The digestive system receives less blood, causing a feeling of being full or sick. Symptoms that indicate a severe heart condition that require immediate medical attention is chest pain that radiates through the upper body. This can also be a sign of a heart attack. Rapid breathing, sudden weight gain, troubled sleeping, skin that appears blue, which is from lack of oxygen in your lungs, and fainting. Some diagnosis and treatment. Your doctor will ask you many questions about your symptoms and medical history. You will be asked about any conditions you have that may cause heart failure, such as coronary artery disease, angina, diabetes, heart valve disease, and high blood pressure. You will be asked if you smoke, take drugs, drink alcohol, and how much you drink, and about what drugs you take. This is all part of your medical history exam, diet, and social history. Physical examinations include beginning with observing the patient to decide how comfortable they are at rest and whether the walk to the exam area made them short of breath. Vital signs include blood pressure, pulse rate, respiratory rate, oxygen saturation, and body weight may be helpful to assess how ill the patient might be. The exam often concentrates on the heart and lungs using tests such as the MRI, which takes pictures of your heart, stress tests to see how well your heart performs under different levels of stress, some blood tests to check for abnormal blood cells and infections. In most cases, there are no cures. However, early diagnosis and treatment can improve quality and length of life for people who have heart failure. Treatment usually involves taking medicines, reducing sodium in the diet, and getting daily physical activity. Here are some medications for congestive heart failure. You have some ACE inhibitors, which are drugs that relax the blood vessels. Some of the most common prescribed are Capitan, Vasotec, and Zestril. There's beta blockers, which help lower blood pressure and slow your heart. They also block the harmful effects of some of the hormone-like substances that advance heart damage. Over time, beta blockers may also improve the pumping actions of the heart. Commonly prescribed beta blockers include Coreg and Lopressor Toprol. And then there's diuretics, or water pills, which help rid the body of excess fluids that may collect in your lungs, stomach, feet, or ankles. Less fluid in your body will decrease the workload of your heart. In addition to excess fluid, diuretics may also deplete your body of potassium. Potassium helps to balance the fluid in your body's cell. It is important for your muscles to work properly. Some common diuretics include Lasix, Bumex, Demandex, and HCTZ. Then we have digoxin, which is a medication that can help the heart muscle pump more effectively. It can also regulate a heartbeat that is too rapid or irregular. Effects of congestive heart failure on exercise response. Patients have usually been advised to avoid exercise because of concerns that they would experience a further decline in cardiac function. However, it has been demonstrated that exercise capacity is not related to the degree of left ventricular systolic dysfunction. This has led to the suggestion that peripheral changes in skeletal muscles and blood supply may play a major role in determining the exercise capacity of patients with congestive heart failure. Studies have demonstrated abnormalities of skeletal muscle blood flow, metabolism, and structure, all of which are consistent with the impaired performance observed in these patients. Why exercise is good for congestive heart failure? Exercise is good for congestive heart failure because it decreases mortality and morbidity such as angina symptoms and heart failure symptoms. You increase your fitness level and your general well-being. My case study is a 63-year-old man who is 5'11" and weighs 190 pounds. He has been treated for 2 myocardial infarctions and hypertension. He had an aortic coronary bypass 1 year ago. He appears to have shortness of breath. When evaluating him, I found that he didn't have family history, a myocardial infarction, coronary revascularization, or sudden death before 55 years of age in father or other male first-degree relative, or before 65 years of age in mother or other female first-degree relative. He doesn't smoke. However, he is obese. His body mass index is 26.5. He doesn't suffer from hypercholesterolemia, and he has a sedentary lifestyle. I've classified him as high risk. Before we proceeded with our exercise testing, we made sure he was cleared by his cardiologist prior. The doctor had him perform the stress test, in which he had to start off walking on a treadmill, then progressing to a slow run. During this time, many tests were being done to his heart. He was cleared. So then we took my client and I had him do the Austrian rhyming protocol on the cycle ergometer to receive all of his vitals. The Austrian test involves only a single stage, and the goal is to elicit a steady state heart rate over a 6-minute period. Workload is set during the first minute and maintained throughout the duration of the test. Then VO2 max is determined by using a nomogram that utilizes the workload value and steady state heart rate. During the test, I retrieved all of his vitals, including blood pressure, heart rate, etc. Because he is at high risk, I wanted to take things slow with him and have a doctor present at times. The frequency would be 4 to 6 days a week for aerobic. For resistance, it would be 2 to 3 days a week. And for flexibility, it would be every day. For intensity, it is best to have him perform at 40 to 80% of his heart rate max, 75% of 1 rep max for resistance, and flexibility hold to point of discomfort. For type, we had him walking, biking, jogging, swimming, stairs for aerobics, and we want to incorporate it more into his daily activities by parking far away at the supermarket or at work so he could walk farther. For resistance training, we had him do free weights, weight machines, body weight squats, such as squat to overhead press, dumbbell rows, leg press, lat pull down, hip abductors, and hip adductors. For flexibility, we had him do static stretching of major muscle groups, such as the butterfly, lunges, straddle stretch, quad pullbacks, hand down the spine, and arm across the chest and toe touches. For duration or time of his exercises, for aerobics, we had him do 20 to 60 minutes. Resistance training was 8 to 10 exercises with 8 to 12 repetitions, and flexibility for 5 to 10 minutes. Now, the entire time we were keeping a good watch on his heart and his blood pressure and his heart rate, making sure that they all stay in normal ranges. In conclusion, getting back to exercise after suffering from a myocardial infarction is a very long, tough process. But with time, patience, the right exercise prescription, and a good diet, it is possible to get back to a normal lifestyle.